Muscle groups that might be wasted? Quads, calf. Yeah, calf's the big one that we often sort of gets neglected. But yeah, definitely gastroc. What else we're looking for? Foot position. Yeah, often externally rotated potentially. Looking at arches of the feet, are they sort of really flat foot with both sides, or is one foot a lot more flat than the other side? Again, we can throw in the single leg balance, and just look again, testing sort of gluteal strength really, and willingness to actually weight bear through the knee really. You know, are they comfortable to do that? Does that bring on, you know, sort of pain straight away really? Okay. And I also have a look at them ambulating, walking. Okay. Can I have a line here on the back? So have a lie flat down. Back down. So again, looking for swelling, feeling for any heat in the back of the hand, and then palpating for synovial thickening along the joint line. So that boggy sort of feeling around the edge of the joint line. And again, here you can obviously assess any difference in quads and gastroc. And again, you can have a look at the position of the patella, etc. in this position, and whether, you know, one leg's out to the side from the hip, you know, more externally rotated is quite nice just to eyeball that from the bottom of the bed. So first of all, we're going to have a look at joint above. Yeah, so we're going to check clear the hip. So again, those younger patients or those patients where you're curing maybe an arthritic condition from the hip. So just as before, I'm going to lift up, one hand on the thigh on the other side, and just have a little feel into the hip flexion there. Okay, and then back, and you just test some medial rotation, looking for that capsular pattern of the hip. Okay, and hopefully once you've cleared that, you move down to the knee. So first of all, just going to look at passive flexion. So hands in there, and get a nice end feel in that position. Okay, what's the capsular pattern of the knee? Yeah, more loss of flexion than extension, but so you do get some loss of extension in some severe cases. So passive flexion on both sides, obviously, and then you're going to come in and do passive extension. So there's two ways you can do this. Or you can do it in this position here, looking for that end feel. So it's quite a lot of hyperextension, not quite as much on that side. Okay. And then the other way of doing this, just to get a nice end feel and try and get the patient relaxed, is just to drop them just like that into extension. And what would maybe indicate, what sort of end feel would indicate a loose body or meniscal lesion potentially? Yeah, a springy end feel, yeah. So that's quite a nice end feel there, so fine. Okay. This is good. So you've done passive range of movements. At this stage you can just turn over on your front and we'll just do the strength test. So again, come around this side as previously. So nice step stand, straight arm here, and then just pull up. Don't let me push you down. Don't let me push you down. Okay, so again, good stress there. And then remembering last time, especially if you've got someone who you think is going to be quite strong, one hand in the popliteal fossa there, coming round, fixing in here. Right, Stephen, try and push me away as hard as you can. Don't let me move it. Good. Okay, not too bad. All right, turn back over on the back again. So I've tested contractile structures and the joint range of movement. So now we're going to come on to ligament testing. So first of all, we're going to do a test the medial lateral ligament. So valgus stress test. You come this way to the edge of the bed a little bit, see if that's okay. So I'm just going to get the leg into this position. We're just going to internally rotate the hip just to fix it in there. About 20 to 30 degrees flexion, and then I'm just going to come in into there. Okay, it's a nice short, sharp pull in there. Okay, so we're testing for laxity and obviously discomfort as well at that point. Now, testing the lateral collateral ligament. The easiest way, if you come, I'll come on the other side. So this is pretty easy to show you. If you come to this side of the bed. So just coming down and sit on the edge of the bed. Okay. You're going to get the legs supported, and there again coming into 20 30 degrees flexion, and then we're just going to come apply like a varus stress there. So you're fixing with this hand, that's varus stress in there. Okay. Obviously, if there's any issues with getting right in there with the patient, you can do that in a standing position. Just make sure you fix the leg next to the body, and you're trying to apply a varus stress in that position. So for some patients that might be better than there, or if you feel comfortable doing it really. Just if you do sit on there, it's quite nice to rest the leg, get it nice and relaxed to actually get that purchase on it. So medial and lateral ligaments tested.
Can I ask, sorry, is it the feel that you're
So if it's partial tear, you're going to get pain. If it's a full rupture, you're not going to get any pain with that. But it's more a laxity, comparable to the other side. So often with the medial ligament, it might be a partial, like grade 2 tear, so you're going to get some laxity as well as pain. So it is important that you, although it's painful, you do get that end feel, okay? Because you want to establish, what grade of injury it is. But if it's not painful and it's very wobbly, then you're probably looking at potentially a full rupture of the ligament, okay? So next we're going on to coronary ligament testing. So 90 degrees, 90, okay, so 90 degrees to the hip, 90 degrees to the knee, okay? Arms going to rest in this position here. With the other hand, going to work into external rotation. So we're just trying to stress the medial coronary ligament at that point. So again, reproduction of pain in this area. And again, we're looking for how far we can actually go with that. So there's a massive difference in how far we can rotate compared to the side. And again, it's a greater extent of injury, so it's coming there. So it's quite a nice relaxed position. You get quite a good wind up on that, just doing that position there. And it's exactly the same, just going in the opposite direction. But mainly